welcome back to my channel Agape Vlogs. How are you all? First of all, I thank all the new subscribers who have walked into Agape Vlogs, and this time I am with a new set of questions. Test 3, 50 questions. I already completed test 1 in 3 series, 2 in 2 series, and this is test 3. I am thinking of completing it in a single series. If any of you would like all these 50 questions to be splitted and posted in batches, do let me know, because posting all the 50 questions in a stretch is a tedious job for me as well. But if I am trying to do this thinking that it will be beneficial for you, but on the other hand, if you people like to have it in blocks itself, like a part of 10 questions, 15 questions, 25 questions, like that, I will do it like that only, because that is an easy job for me as well. But I don't want to delay my post, but I request you to tell me how I should do. Okay, well, let's go on to the video. To prepare well, when you are listening to these questions, kindly note down your scores so that towards the end of the session you can find out your stats. So let's start with the first question. A 17-year-old patient who was involved in an orthopedic accident is observed not eating the meals that she previously ordered and refuses to take a bath even if she is already in recovery stage. As a nurse, what do you think is the best explanation for her reaction to the accident that happened to her? Go through the question again. The options are A. Suppression, B. Undoing, C. Regression, D. Repression. So she is undergoing regression. The answer is option C. Well, let's come to the second question. What does AVPU mean? I think we have referred to AVPU in the last post of mine in test 2. Anyways, the options here are different. Option A is alert, verbalization, pain, unconsciousness. Option B is awake, voice, pain, unconsciousness. Option C is alert, voice, pain, unresponsive. And D is awake, verbalization, pain, unconscious. Options are quite tricky. All are looking almost similar. So all you have to know is you have to know what does AVPU stand for. Hope you remember we coming across this question like something related to news, NEWS. In that we had this word coming across. Anyways, I'll tell you what AVPU scale is. A system by which a healthcare professional can measure and record a patient's level of consciousness. It is mostly used in emergency medicine protocols. Okay, and I'll tell you what AVPU stand for. A stands for alert, V for verbal, P for pain, and unresponsive is for U. The third option as alert, voice, pain, unresponsive. So that's the right choice. Okay. Similar to this scale, we also have the GCS, that is the Glasgow Coma Scale. It also is somewhat similar to this. So I know you all know this, so I'm not coming to all that. But still, let me tell you what it is. The Glasgow Coma Scale is the most common scoring system used to describe the level of consciousness in a person following a traumatic brain injury. Okay, so here also a person's level of consciousness is measured using the Glasgow scale following a traumatic brain injury. So AVPU and GCS are related to same thing. Okay, so let's come back to the question. The answer is option C, alert, voice, pain, unresponsive. Okay. Okay, let's go to the third question. Where will you put infectious linen? This question also something similar to this we had in test 2. Hope you all remember. Anyways, I'll come to the options here, which is quite different from the last sessions. Option A is red plastic bag designed to disintegrate when exposed to heat. Option B is red linen bag designed to hold its integrity even when disposed to heat. And option C is yellow plastic bag for disposal. So where will you put infectious linen? The answer is option A, that is red plastic bag designed to disintegrate when exposed to heat. Okay, got it. So let's come to the fourth question. Who is responsible in disposing sharps? Option A, registered nurse. Option B, nurse assistant. Option C, whoever use the sharps. Option D, whoever collects the garbage. Whoever use the sharps is responsible in disposing the sharps. So option C is the right answer. Question number 5. NMC requires in the UK how many units of continuing education units a nurse should have in 3 years? Option A, 35 units. Option B, 45 units. Option C, 55 units. Option D, 65 units. So what is the answer? You guys aspiring to be a nurse in UK should know it rightly. Okay, option A, 35 units is the right answer. Sixth question. What do you expect to assess in a grade 3 pressure ulcer? Options are option A, blistered wound in the skin. Option B, open wound exposing tissue. Option C, open wound exposing muscles. Option D, open wound exposing bones. What do you expect to assess in a grade 3 pressure ulcer? Option B is the right answer. Option B, open wound exposing tissue. Seventh question. What could be the reason why you instruct your patient to return on its original container and discard nitroglycerine medicines after 8 weeks? Option A, removing from its darkened container exposes the medicine to the light and its potency will decrease after 8 weeks. Option B, it will have a greater concentration after 8 weeks. Option A is the right choice. Removing from its darkened container exposes the medicine to the light and its potency will decrease after 8 weeks. That's the right answer. Listen to the question very carefully. It's a elaborate question. An 83-year-old lady just lost her husband. Her brother visited the lady in her house. He observed that the lady is acting okay, but it is obvious that she is depressed. 3 weeks after the husband's death, the lady called her brother crying and was saying that her husband just died. She even said, "I can't even remember him saying he was sick." When the brother visited the lady, she was observed to be well physically but was irritable and claims to have frequent urination at night, and she verbalizes that she can see lots of rats in their kitchen. Based on the manifestations as a nurse, what will you consider as a diagnosis to this patient? Options are option A, urinary tract infection leading to delirium. Option B, delayed grieving with dementia. So the question clearly says that she has frequent urination at night. So you can get the answer there itself. The option A is the right choice, urinary tract infection leading to delirium. Okay. Delirium is an abrupt change in the brain that causes mental confusion and emotional disruption. So that's it. Question number 9. As you visit your patient during rounds, you notice a thin child who's shy and not mingling with the group, who seemed to be visitors of the patient. You offered him food, but his mother told you not to mind him as he is not eating much while all of them are eating during that time. As a nurse, what will you do? Option A, inform social service desk on suspected case of child neglect. Option B, ignore incident since the child is under the responsibility of the mother. Option C, raise the situation to your head nurse and discuss with her what intervention must be done to help the child. Option C is the right answer. Question number 10. You are to take charge of the next shift of nurses. Few minutes before your shift, the in charge of the current shift informed you that 2 of your nurses will be absent. Since there is a shortage of staff in your shift, what will you do? Options are option A, encourage all the staff who are present to do their best to attend to the needs of the patients. Option B, ask from your manager if there are qualified staff from the previous shift that can cover the lacking number for your shift while you try to replace new nurses to cover. Option C, refuse to take charge of the next shift. So what are you going to do? Option B, ask from your manager if there are qualified staff from the previous shift that can cover the lacking number for your shift while you try to replace new nurses to cover will be the right choice. Option B is the right answer. Okay, coming to question number 11. Who will inform first if there is shortage in supplies in a shift? Nursing assistant, purchasing person, immediate nurse manager, supplier. Option A is nursing assistant. Option B is purchasing personnel. Option C is immediate nurse manager. Option D is supplier. So option C, immediate nurse manager, is the right answer. Question number 12. What do you mean by MRSA? Options are option A, methicillin resistant staphylococcus aureus. Option B, multiple resistant staphylococcus antibiotic. Option A is the right choice, methicillin resistant staphylococcus aureus. Option A is the right answer. Coming to question number 13. A young mother who delivered 48 hours ago comes back to the emergency department with postpartum hemorrhage. What type of PPH is it? Options are option A, primary postpartum hemorrhage. Option B, secondary postpartum hemorrhage. Option C, tertiary postpartum hemorrhage. Option B, secondary postpartum hemorrhage, is the right answer. Option B is the right answer. Question number 14. As a registered nurse in a unit, what would consider as a priority to a patient immediately post-operatively? Options are option A, pain relief. Option B, blood loss. Option C, airway patency. Right answer is option C, airway patency. Coming to the 15th question. Which is the most dangerous site for intramuscular injection? Options are option A, ventrogluteal. Option B, deltoid. Option C, rectus femoris. Option D, dorsogluteal. So question is, which is the most dangerous site for intramuscular injection? So dorsogluteal site is the most dangerous site for IM injections. Option D is the right answer. Question number 16. A solution contains 12.5 grams of glucose in 0.25 liters. What is the percentage concentration or the percentage of this solution? Options are option A 5%, option B 10%, option C 25%. Option A 5% is the right answer. Question number 17. A liter bag of 5% glucose is prescribed over 4 hours. If a standard giving set is used, at what rate should the drip be set? Option A 83, option B 60, option C 24. Option A 83 is the right answer. Question number 18. You believe that an adult you know and support has been a victim of physical abuse that might be considered a criminal offence. What should you do to support the police in an investigation? Options are option A, question the adult thoroughly to get as much information as possible. Option B, take photographs of any signs of abuse or other potential evidence before cleaning up the victim or the crime scene. Option C, explain to the victim that you cannot speak to him unless a police officer is present. Option D, make an accurate record of what the person has said to you. So what will be the right choice be? I know you're a bit confused. I'll come directly to the answer. Option D, make an accurate record of what the person has said to you, is the right answer. Question number 19. If you suspect abuse is happening to someone and it is not serious enough to involve the police straight away, who should you inform? Option A, a manager with safeguarding responsibility if within an organization, or adult social care directly if you are a member of the public. Option B, no one. It is up to the adult at risk to raise the alert. Option C, the adult's next of kin. Option D, everyone with a caring responsibility for the adult. So you are not supposed to inform everyone. Anyways, I'll come to the answer. Option A is the right answer. That is, a manager with safeguarding responsibility. That is within an organization, or adult social care directly if you are a member of the public. Okay. Question number 20. If you were told by a nurse at handover to take standard precautions, what would you expect to be doing? Options are taking precaution when handling blood and high-risk body fluids so that you don't pass or any infection to the patient. Option B, wearing gloves, aprons and mask when caring for someone in protective isolation to protect yourself from infection. Option C, asking relatives to wash their hands when visiting patients in the clinical setting. Option D, using appropriate hand hygiene, wearing gloves and aprons when necessary, disposing of used sharp instruments safely, and providing care in a suitably clean environment to protect yourself and the patients. Okay, option D is the right answer. Option D, using appropriate hand hygiene, wearing gloves and aprons when necessary, disposing of used sharp instruments safely, and providing care in a suitably clean environment to protect yourself and the patient is the right answer. Question number 21. What would make you suspect that a patient in your care had a urinary tract infection? Options are: Option A, the doctor has requested a midstream urine specimen. Option B, the patient has a urinary catheter in situ and the patient's wife stated that he seems more forgetful than usual. Option C, the patient has spiked temperature, has a raised white cell count WCC, has new onset confusion, and the urine in his catheter bag is cloudy. Option D, the patient has complained of frequency of fecal elimination and hasn't been drinking enough. Option C is the right choice, that is, the patient has spiked temperature, has a raised WCC, has new onset confusion, and the urine in his catheter bag is cloudy. Question number 22. You are caring for a patient in isolation with suspected C. difficile. What are the essential key actions to prevent the spread of infection? Options are: Option A, regular hand hygiene and the promotion of infection prevention link nurse role. Option B, encourage the doctors to wear gloves and aprons to be bare below the elbow and to wash hands with alcohol hand rub. Ask for cleaning to be increased with soap-based products. Option C, ask the infection prevention team to review the patient's medication chart and provide regular teaching sessions on the 5 moments of hand hygiene. Provide the patient and family with adequate information. Option C, review antimicrobials daily. Wash hands with soap and water before and after each contact with the patient. Ask for enhanced cleaning with chlorine-based products and use gloves and aprons when disposing of body fluids. Here, all 4 are right. So 4 options can be ticked as the right choice. Number 23. What steps would you take if you had sustained a needle stick injury? Options are: Option A, ask for advice from the emergency department, report to occupational health and fill in an incident form. Option B, gently make the wound bleed, place under running water and wash thoroughly with soap and water. Complete an incident form and inform your manager. Cooperate with any action to test yourself or the patient for infection with the blood-borne virus, but do not obtain blood or consent for testing from the patient yourself. This should be done by someone not involved in the incident. Option 2 is what I have read right now. Option 3 is take blood from patient and self for hepatitis B screening and take samples and form to bacteriology. Call your union representative for support. Make an appointment with your GP for a sickness certificate to take time off until the wound site has healed so you don't contaminate any other patients. Option D is wash the wound with soap and water. Cover any wound with a waterproof dressing to prevent entry of any other foreign material. So, the question was, what steps would you take if you had sustained a needle stick injury? Option B is the right choice. That is, gently make the wound bleed, place under running water and wash thoroughly with soap and water. Complete an incident form and inform your manager. Cooperate with any action to test yourself or the patient for information with a blood-borne virus, but do not obtain blood or consent for testing from the patient yourself. This should be done by someone not involved in the incident. So that's the right choice. Question number 24. What factors are essential in demonstrating supportive communication to patients? Option A, listening, clarifying the concerns and feelings of the patient, using open questions. Option B, listening, clarifying the physical needs of the patient using closed questions. Option C, listening, clarifying the physical needs of the patient using open questions. D, listening, reflecting back the patient's concerns and providing a solution. Option A is the right choice, that is listening, clarifying the concerns and feelings of the patient using open questions. Question number 25. Dehydration is of particular concern in ill health. If a patient is receiving IV fluid replacement and is having their fluid balance recorded, which of the following statements is true of someone said to be in a positive fluid balance? Options are: Option A, the fluid output has exceeded the input. Option B, the doctor may consider increasing the IV drip rate. Option C, the fluid balance chart can be stopped as positive in this instance means good. Option D, the fluid input has exceeded the output. Fourth option is the right answer, that is, the fluid input has exceeded the output. Question number 25. What specifically do you need to monitor to avoid complications and ensure optimal nutritional status in patients being enterally fed? Option A, blood glucose levels, full blood count, stoma site and body weight. Option B, eyesight, hearing, full blood count, lung function and stoma site. Option C, assess swallowing, patient choice, fluid balance, capillary refill time. Option D, daily urinalysis, ECG, protein levels and arterial pressure. Question was, what specifically do you need to monitor to avoid complications and ensure optimal nutritional status in patients being enterally fed? So the right one is option A, that is blood glucose levels, full blood count, stoma site and body weight. Question number 27. What is the best way to prevent a patient who is receiving an enteral feed from aspirating? Options are: Option A, lie them flat. Option B, sit them at least at a 45-degree angle. Option C, tell them to lie on their side. Option D, check their oxygen saturations. Option B, sit them at least at a 45-degree angle is the right answer. Question number 28. Which check do you need to carry out before setting up an enteral feed via a nasogastric tube? Options are: Option A, that when flushed with red juice, the red juice can be seen when the tube is aspirated. Option B, that air cannot be heard rushing into the lungs by doing the whoosh test. Option C, that the pH of gastric aspirate is less than 5.5 and the measurement on the NG scale, that is the nasogastric tube, not scale, I said scale, it is tube. Nasogastric tube is the same length as the time insertion. Option D, that pH of gastric aspirate is less than 6.0 and the measurement on the NG tube is the same length as the time insertion. Option C is the right choice, that is that the pH of gastric aspirate is less than 5.5 and the measurement of the NG tube is the same length as the time insertion. Okay, so third option is the right answer. Question number 29. Why should healthcare professionals take extra care when washing and drying an elderly patient's? Options are: as the older generation deserve more respect and tender loving care. Options B, as the skin of an elder person has reduced blood supply, is thinner, less elastic and has less natural oil. This means the skin is less resistant to shearing forces and wound healing can be delayed. Option C, all elderly people lose dexterity and struggle to wash effectively, so they need support with personal hygiene. Option D, as elderly people cannot reach all areas of their body, it is essential to ensure all body parts are washed well so that the colonization of gram-positive and negative microorganisms on the skin is avoided. Option B is the right choice. The question was, why should healthcare professionals take extra care when washing and drying an elderly patient's skin? The right answer is option B, that is, as the skin of an elderly person has reduced blood supply, is thinner, less elastic and has less natural oil. This means that the skin is less resistant to shearing forces and wound healing can be delayed. That's right. This is the right answer. Question number 30. What should be included in your initial assessment of your patient's respiratory status? Option A. Review the patient's notes and charts to obtain the patient's history. Option B. Review the status of routine investigations. Option C. Observe the patient's breathing for ease and comfort, rate and pattern. Option D. Perform a systematic exam and ask the relatives for the patient's history. Option C is the right answer, that is, observe the patient's breathing for ease and comfort, rate and pattern, because you are asked what should be included in your initial assessment of a patient's respiratory status. So you have to observe the patient's breathing for ease and comfort, rate and pattern. Okay. Question number 31. When using nasal cannulae, the maximum oxygen flow rate that should be used in 6 liters per minute. Why? First option, nasal cannulae are only capable of delivering an inspired oxygen concentration between 24% and 40%. Option B, for any given flow rate, the inspired oxygen concentration will vary between breaths, as it depends upon the rate and depth of the patient breath and the inspiratory flow rate. Option C, higher rate can cause nasal mucosal drying and may lead to epistasis. Option D, if oxygen is administered at a greater than 40%, it should be humidified. You cannot humidify oxygen via nasal cannulae. So option C is the right answer. This higher rates can cause nasal mucosal drying and may lead to epistasis. You know what is epistasis? It's nose bleeding. Question number 32. Why is it essential to humidify oxygen used during respiratory therapy? Options are: Option A, oxygen is a very hot gas, so if humidification isn't used, the oxygen will burn the respiratory tract and cause considerable pain for the patient when they breathe. Option B, oxygen is a dry gas which can cause evaporation of water from the respiratory tract and lead to thickened mucus in the airways, reduction of the movement of cilia, and increased susceptibility to respiratory infection. Option C, humidification cleans the oxygen as it is administered to ensure it is free from any aerobic pathogens before it is inhaled by the patient. Option B is the right answer. Why is it essential to humidify oxygen during respiratory therapy? Because it's a dry gas which can cause evaporation of water from the respiratory tract and lead to thickened mucus in the airways, reduction of the movement of cilia, and increased susceptibility to respiratory infection is the right answer. That is option B. Question number 33. Which of the following would indicate an infection? Options are: Option A, hot, sweaty, temperature of 36.5 degrees Celsius and bradycardic. Option B, temperature at 38.5 degrees Celsius, shivering, tachycardic and hypertensive. Option C, raised WBC, elevated blood glucose and temperature of 36 degrees Celsius. Option D, hypertensive, cold and clammy and bradycardic. Option B is the right answer. Temperature of 38.5 degrees Celsius, shivering, tachycardic and hypertensive. This can indicate an infection. Question number 34. A nurse is having trouble with doing care plans. Her team members are already noticing this problem and are worried of the consequences this may bring to the quality of nursing care delivered. The problem is already brought to the attention of the nurse. The nurse should, first option, accept her weakness and take this challenge as an opportunity to improve her skills by requesting lectures from her manager. Option B, ignore the criticism as this is the case of a team issue. Option C, continue delivering care as this will not affect the quality of care you are rendering your patient. Come on guys, you are going to accept her weakness and take this challenge as an opportunity to improve her skills by requesting lectures from her manager. So this is going to be the mindset. Question number 35. You are a registered nurse in a community giving health education to a patient and you notice that the student nurse is using his cell phone to text. What should you do? Options are: Option A, tell the student to leave and emphasize what a disappointment she is. Option B, report the student to his instructor after duty. Option C, politely signal the student and encourage him by actively including him in the discussion. Okay, third option is the right choice. That is, politely signal the student and encourage him by actively including him in the discussion. Okay. Question number 36. Which one of the following types of wound is not suitable for negative pressure wound therapy? Options are 1. Partial thickness burns, 2. Contaminated wounds, 3. Diabetic and neuropathic ulcers, 4. Traumatic wounds. Contaminated wounds, that is option B or the second option, is the right answer. Question number 37. How long does the inflammatory phase of wound healing typically last? So, I know the answer has already come to your mind. Anyways, let me read the options. Option A, 24 hours. Option B, just minutes. Option C, 1 to 5 days. And option D, 3 to 24 days. Option C, 1 to 5 days is the right answer. You have already come across this question in test 1, I believe. Anyways, 1 to 5 days, option C is the right answer. 38th question. Which of the following methods of wound closure is most suitable for a good cosmetic result following surgery? Option A, skin clips. Option B, tissue adhesives. Option C, adhesive skin closure strips. And option D, interrupted suture. Option A, skin clips is the right answer. Question number 39. You notice an area of redness on the buttock of an elderly patient and suspect they may be at risk of developing a pressure ulcer. Which of the following would be the most appropriate to apply? Option A, negative pressure dressing. Option B, rapid capillary dressing. Option C, alginate dressing. Option D, skin barrier product. Skin barrier product is the right answer. Option 4 or option D is the right answer. These two questions somebody has asked me earlier, 38 and 39 questions. Okay. Question number 40. What are the 4 stages of wound healing in the order they take place? Option A, proliferative phase, inflammation phase, remodeling phase, maturation phase. Option B, hemostasis, Option B, hemostasis, inflammation phase, proliferation phase, maturation phase. Option C, inflammatory phase, dynamic stage, neutrophil phase and maturation phase. Option D, hemostasis, proliferation phase, inflammation phase, remodeling phase, support. Option B is the right choice, that is hemostasis, inflammation phase, proliferation phase and maturation phase. These are the 4 stages of wound healing in the order they take place. Okay, coming to the 41st question. How soon after surgery is the patient expected to pass urine? Options are option 1, 1 to 2 hours. Option B, 2 to 4 hours. Option C, 4 to 6 hours. Option D, 6 to 8 hours. Option D, 6 to 8 hours is the right answer. Question number 42. What functions should a dressing fulfill for effective wound healing? I think this question also we have come across earlier. Anyways, the options are option 1, high humidity, insulation, gaseous exchange, absorbent. Option B, anaerobic, impermeable, conformable, low humidity. Option C, insulation, low humidity, sterile, high adherence. Option D, absorbent, low adherence, anaerobic, high humidity. Option A is the right answer, that is high humidity, insulation, gaseous exchange and absorbent. Third question. When would it be beneficial to use a wound care plan? Option A, on all chronic wounds. Option B, on all infected wounds. Option C, on all complex wounds. On every wound is the fourth option. On every wound is the right answer. That is option D is the right answer. Question number 44. How would you care for a patient with a necrotic wound? Options are option A, systematic antibiotic therapy and apply a dry dressing. Option B, debride and apply a hydrogel dressing. Option C, debride and apply an antimicrobial dressing. Option D, apply a negative pressure dressing. Option B, debride and apply a hydrogel dressing is the right choice. Question 45. A new post-surgical wound is assessed by the nurse and is found to be hot, tender and swollen. How could this wound be best described? Options are 1, in the inflammation phase of healing, 2, in the hemostasis phase of healing, 3. In the reconstructive phase of wound healing. 4. As an infected wound. Option A, in the inflammation phase of healing, is the right choice. That is option 1. Question number 46. When a patient is being monitored in the PACU, how frequently should blood pressure, pulse and respiratory rate be recorded? Option A, every 5 minutes. Option B, every 15 minutes. Option C, once an hour. Option D, continuously. Option A, every 5 minutes is the right answer. Since the PACU or the post-anesthesia care unit is a critical care unit, the patient's vital signs are closely monitored and recorded every 5 minutes. Question number 47. Safe moving and handling of an anesthetized patient is imperative to reduce harm to both the patient and staff. What is the minimum number of staff required to provide safe manual handling of a patient in theatre? Option A, 3, 1 either side, 1 at head. Option 2, 5, 2 each side, 1 at head. Option 3, 4, 1 each side, 1 at head and 1 at feet. Option D, 6, 2 each side, 1 at feet and 1 at feet. So option C, that is 4, is the right answer. 4 means 1 each side, 1 at head and 1 at feet. Okay. Question number 48. Why are anti-embolic stockings an effective means of reducing the potential of developing a deep vein thrombosis? This question also we have already discussed. Option A, they promote arterial blood flow. B, they promote venous blood flow. Option C, they reduce the risk of postoperative swelling. Option D, they promote lymphatic fluid flow and drainage. And B, they promote venous blood flow is the right answer. Question number 49. Listen to the question and all the options very carefully. You are looking after a postoperative patient, and when carrying out their observations, you discover that they are tachycardic and anxious with an increased respiratory rate. What could be happening? What would you do? Options are: the patient is showing symptoms of hypovolemic shock. Investigate source of fluid loss, administer fluid replacement and get medical support. Option B, this patient is demonstrating symptoms of atelectasis. Administer a nebulizer, refer to physiotherapist for assessment. Option C, the patient is demonstrating symptoms of uncontrolled pain. Administer prescribed analgesia, seek assistance from medical team. Option D, the patient is demonstrating symptoms of hyperventilation. Offer reassurance, administer oxygen. So you got 4 different types of options here. And what would you do? What could be happening? It's a serious question and a serious answer. Option A is the right choice. The patient is showing symptoms of hypovolemic shock. Investigate source of fluid loss. Administer fluid replacement and get medical support. The last question, question number 50. Who would mark the skin with an indelible pen ahead of surgery? Options are: the nurse should mark the skin in consultation with the patient. Option B, a senior nurse should be asked to mark the patient's skin. Option C, the surgeon should mark the skin. Option D, it is best not to mark the patient's skin for fear of distressing the patient. So I know you know the answer well. Option C, the surgeon should mark the skin. So it's done. The test 3 is done. I think you had a very tough time as well. I too had to make a strenuous effort to complete all these 50 questions in a stretch. Anyways, I really wish it will be beneficial for you. So no problem for me at all. If it has to be split into blocks, please do report me. Anyways, wish you all the best for your forthcoming exams. Take care of health, don't panic, and you are going to be the best. Okay, bye-bye.